what kind of logic goes into removing or discussing removing radiation shields from patients undergoing some kind of a radiological exam? The philosophy that we use in industry is called a LARA, as low as reasonably achievable. In other words, what makes sense? How much shielding do you really need? To put it in context, if you get about 3 millirem per day just from natural background, from the radon, the air we breathe, from the ground underneath us, from the primordial radioactivity in the earth, and from cosmic rays in outer space, you get about 3 millirem per day. And if that's what you normally get, how much money should you spend, for example, to prevent an additional 1 millirem, right? You don't want to spend $1 million, that's pretty much insane, right? But if you can do it basically for nothing, then maybe that makes sense. If it doesn't cause problems with throughput, patient experience, with quality of the exam, if it doesn't cost you anything, then yeah, go ahead and do it. But if it costs you something, then you got to go back and look at it. Now that makes sense for a patient to talk about that. If they're only getting one exam or 1 or 2 exams per year or something like that, then you can have that discussion. What is it really worth to make them wear a big lead apron? But if it's the technician, then that's a different discussion, because the technician's there probably 8 hours a day, 5 days a week, 50 weeks a year, something like that, as opposed to the patient. And so it really just comes down to that principle, LARA. What really makes sense in terms of being able to reduce the dose while improving the quality of the product? It's kind of like, you think of in health physics, that's what we call this. We call this optimization. You think of dose like a waste product. Like when I make anything, I'm going to have some waste, and the good engineering practice is to reduce the waste. You can't ever have zero waste, but you can minimize the waste. And that's the way we think of dose, and that's how you do dose management. You want to minimize it in a way that makes sense. So, great question. Thanks for asking it.